My name is Kara Britton. I serve as co-chair of Advocates for Ohio's Future and as Director of Public Policy and Advocacy for the Center for Community Solutions. Advocates for Ohio's Future promotes health and service budget and policy solutions so that all Ohioans live better lives. I'm here today with our partners at the Ohio Children's Budget Coalition and many of my fellow advocates across the spectrum of health and human services to ask, who is this budget for? When the Ohio Senate presented its version of the budget last week, it was an opportunity to develop visionary policies that invest in the most valuable asset in the state, its people. After a year that none of us anticipated, but one that certainly brought into focus what's important in life, it's an opportune time for the state to invest in children and families in a major way. The policies included in the budget instead do not focus on people and families. The budget presented last week, in fact, derails Ohio Medicaid's plan for a more person-centered design to healthcare, threatens the work toward coordinated care for children and youth with complex health and behavioral care needs who often must seek care out of state. It jeopardizes decades-long work toward equity and quality in Ohio's publicly funded child care system. And this is the chance to provide a strong investment in broadband access. We understand now more than ever how critical of a service broadband is. You will hear today from people whom I am proud to work alongside talk about how Ohio's leaders have missed a chance to develop a comprehensive budget that focuses on children, families, and communities across the state. I'd like to turn it over to my fellow advocates for Ohio's Future co-chair, Steve Wagner.
Good morning. The budget is a long run, very tiring, close to the end, and there's still time for a final sprint that's going to snatch victory out of the jaws of the heap from where this budget is right now. This budget can still focus on children, schools, families, and all the people that are struggling. But the legislature is going to have to do some hard work to finish strong. We're asking that the legislature make the changes to invest in people and assure that people get the supports they need as Ohio recovers. People need to tell their legislatures how important it is to have childcare, funded schools, broadband so they can get access to medical care, access to schools, access to jobs. And we need the supports in food and housing for those that are still recovering, support in finding work. We're asking that the legislature try to finish strong, improve on what they've done already. They've put in a lot of work. They need to sprint through this end and add these important things to the budget so that Ohio can thrive and progress. I'll turn it back to Kelsey.
Good morning, everyone. My name is Kelsey Burko. I'm the Director of Advocates for Ohio's Future, and I will serve as your moderator for today's events. I would also like to, I'm proud to introduce Dr. Tracy Nahara. She is the Executive Director of the Children's Defense Fund and also leader of the Children's Budget Coalition. So Tracy, please join.
Thank you, Kelsey, and thank you to everyone who's here from the media and our colleagues. My name is Tracy Nahara, and I'm the Executive Director of the Children's Defense Fund of Ohio, and I'm here to represent the Ohio Children's Budget Coalition. We are a partnership of 23 statewide organizations committed to advocating for meaningful legislative and budgetary decisions to create a vision of child well-being in Ohio. As a coalition, we believe that our policymakers must consider childhood as a continuum spanning prenatal through age 18, and in some cases through the early 20s, with many youth in need of additional support to successfully transition to adulthood. We must maximize outcomes for Ohio's children by eliminating silos and building a comprehensive, coordinated continuum of services and programs to holistically address children's issues beyond those artificial boundaries of agencies and funding streams. We must ensure all investments in Ohio's children are data-driven, research-driven, best practices, approaches, programs, and services that maximize benefits for children and families and represent an effective use of taxpayer investments. We believe that the budget itself must maintain, protect, and strengthen everything that we do for children, for their well-being, that will lead to them flourishing into adulthood. So while we appreciate policies and investments prioritizing children and families in the proposed budget thus far, and in the House budget, we are now in the Senate budget, and we need to recognize that our state leaders must go further. We must adopt a budget that provides for whole child well-being, that focuses on the needs of children and families. And they need to do right and invest in programs that lead to a thriving community, excellent schools, accessible and high-quality childcare, safe and nurturing homes and communities, rather than operating with an austerity mindset when it comes to Ohioans who are truly in need. And the repeated tendencies, we must push against the repeated tendencies to give away our taxpayer dollars to those who don't need it. So I just want to mention a couple things, and I'm sure it's something that will pull me off of this video. But prior to the pandemic, there's been a 22% decrease since 2010 in the number of children living in poverty. Amongst the rankings for neighboring states, Ohio trails Michigan. We barely are ahead of West Virginia and Kentucky. Nearly 20% of Ohio's children did not graduate on time prior to the pandemic. Less than the national average, which makes Ohio 38 out of 50 states. Ohio's children were less healthy in 2019 than they were in 2010. In fact, 6% more children were overweight or obese than they were in 2010. And in 2019, 8% more children with teen deaths occurred compared to 2010. The number of low birth weight babies increased 8.5% in 2018 to 8.6 in 19, equating to about 11,500 babies in Ohio potentially facing serious health challenges. Now, just from the U.S. Census Bureau, about 23% of households with children were feeling down, depressed, or hopeless during this pandemic. And you know, there's so many statistics here that demonstrate the need for investments. And I would also just say, you know, Ohio policymakers are critical in everything that we do here. In the state budget deliberations, we are suffering from a shortage of will rather than wallets. While we have the resources to invest in everything that our children need, like publicly funded childcare, expanding postpartum care to low-income parents, and providing for equitable education, there has been resistance to these family-friendly, family-focused supports, everything that we need for our state to flourish and to be prosperous into the future. It's a time for bold in these investments, and we're not seeing it. So we're asking for it now.
So Ms. Tracy, next on our agenda, Mr. Warren Campus, is the policy fellow for the Center for Community Solutions.
Morning, thank you, Kelsey. Thank you, everyone, for attending today's event. My name is Warren Campus, and I'm a policy fellow at the Center for Community Solutions, leading our work in the Center for Medicaid Policy. I'd like to speak to you today about how the Senate substitute bill promotes special interest lobbying and prioritizing profits over market-based competition. The Ohio Medicaid program serves 1 in 4 Ohioans, including the majority of children, older adults, and persons with disabilities in our state. With this enormous responsibility, we must always ask ourselves the question, how and do we achieve the most value for this investment? Currently, we are underperforming. When we look at how much we spend versus what we get on outcomes, we are one of the lowest value states in the country. We still have significant issues, some of our most pressing public health problems like infant and maternal mortality, and the opioid use disorder crisis that, due to the prevalence of opioid addiction in the Ohio Valley specifically, we are seeing rising mortality in the US for the first time since the 1950s, generally. And when it comes to spending and getting a good return on our investment, we need to only look to our recent history with pharmacy benefit managers to see how Medicaid can be manipulated by a few contractors who put program integrity at risk. For these reasons and more, it's quite surprising that the legislature has worked very hard to end custody relinquishment for children and the wasteful middlemanning of PBMs would put those efforts at risk and guarantee contracts to specific companies over relying on managed competition and quality improvement. Right now, 1 in $6 we appropriate in total for the entire budget, not just in the Medicaid program. 1 in $6 we appropriate flow through a managed care company. As recently as 2018, no single plan met all of the minimum performance standards established by the state. What's more, looking at the external quality reviews of our plans, we regularly underperform in regards to children's health, and providers identified significant paperwork issues managing the day-to-day of collaboration. Given the years-long process Ohio undertook to evaluate and rebid the program, modernizing the contracts in ways that promote efficiency, and find over $460 million realized in this budget, the Senate took a misstep in creating this type of regulatory capture, the context of which falls under the shadow of House Bill 6, and the same sort of underperformance we experience in public utilities. We should not be interested in maintaining contracts for underperformers. Instead, we should rely on the marketplace to drive our outcomes. If we want to see PBM reform maintained, this provision needs to be eliminated. If we want to end custody relinquishment for children, this needs to be eliminated. If we want the system to work better, so services are more efficient for providers and people rely on the sound, cost-effective Medicaid program, then we need to have this provision. Thank you.
Thank you, Board. Next up, we have Mr. Mark Butler. Mr. Garrett.
Thank you. I used to get excited about coming here. When I was a kid, I'd jump on the number 10 code bus and jump out. When my own kids were little, we drive and we stand on the map in the map room and find out where we were, get a snack from a little shop, and come up and admire the fossils and the limestone in the columns in this room. But for the last 7 years, I've come here to be a voice for Ohio families who have been suffering so much. Again, my name is Mark Butler, and I'm the parent of a multi-system youth. That means I have a kid with complex needs who needs help from more than one system. There's quite a few of us out there. And as with every parent, I tried my best to get my son Andrew the care he needed. But as he got older, his behavioral issues became too extreme to address at home. After a couple of very severe outbursts, violent outbursts, he was kicked out of school. We had an outburst at home, and we had to take him down to Cincinnati Children's Hospital. It was there that we were told that it wasn't safe to have Andrew return, that he needed out-of-home residential treatment. We were then told that our private insurance would not pay for that, and neither would his Medicaid waiver. The only option for us would be to surrender custody to our county children's services agency. Now, making that phone call was the hardest thing I've ever had to do. My wife and I drove to see Andrew at the facility he was sent to 2 hours away every single weekend. Over 25,000 miles, longer than the circumference of the earth. Now, eventually, Andrew was able to return to our custody, into our community. But I remember making a promise that I would do whatever I could to make sure other parents didn't have to make that heartbreaking decision. And that's why I've been a part of the Ohio Multi-System Youth Coalition now, trying to change the system. Because no one should have to surrender custody of their child to get them the help that they need. Everyone knows that's wrong. I've yet to meet anyone, Democrat, Republican, anyone, who disagrees with that. In Ohio, we made some progress on this issue. But what we truly need is systemic change. That systemic change, I believe, can come about with the implementation of Ohio Rise. I continue to get calls from parents from around the state looking for help. We owe it to those parents to fix what's broken and implementing Ohio Rise as soon as we can. January of 2022 can do that. It can help not just families like mine, but every family that's experiencing a crisis and needs help. And most importantly, helping families navigate complex systems. Derailing Ohio Rise at this point really lets us down and helps those tens of thousands of families that are counting on us to do the right thing. The reason why I liked to come here when I was a kid, and the reason why I wanted to bring my kids here was because this was a fun place for us. It was a place of joy and even hope. And I think that if we can get this across the finish line, it can be a place of joy and hope for all of our families. Thank you.
Thank you, Mark. Next up, we have Julia Jeppardis, Policy Associate with Groundwork Ohio.
Good morning, my name is Julia Jeppardis, and I am a Policy Associate at Groundwork Ohio. Last week, we learned that the Senate substitute bill increased initial eligibility for publicly funded childcare to 142% of the federal poverty level. This was an increase from the governor's and council's proposal of 138%. While we are thankful to see this increase in Ohio's woefully low eligibility rate, we were disappointed to learn about the Senate's decision to effectively end Ohio's 5-star quality rating and improvement system, Step Up to Quality. This decision to eliminate Step Up to Quality came hours after we released a new report by the University of Cincinnati Economics Center and commissioned by Groundwork Ohio that yet again proves that the tremendous value of quality care. The study found that the public investment in quality child care generates a 10% yearly return on public investment, making it not only a great support for children and families, but also a good return for Ohio taxpayers. We know that nearly 60% of Ohio kids are not ready for school when they enter kindergarten and tend to start behind, stay behind. With a significant amount of brain development occurring in the first 5 years of life, access to high quality early learning and care is key to building a strong foundation for Ohio's youngest learners so they are better prepared for kindergarten and beyond. All children, regardless of income, should have access to quality child care, and Step Up to Quality allows low-income children to be on equal footing with their higher income peers by increasing their access to affordable quality childcare. High quality childcare programs go above and beyond babysitting by providing children with developmentally appropriate curriculums, lower teacher-child ratios, access to developmental screenings, referrals and services such as early intervention, access to highly trained and skilled staff, and so much more. Every parent wants the best for their children, and without Step Up to Quality, we are denying low-income parents and children access to quality early learning programs that provide vulnerable families with the tools and resources needed to succeed. Step Up to Quality is not the cause of our current childcare crisis, and eliminating this program does not solve how Ohio continues to pay for childcare. Ohio has continued to fail in investing in the true cost of providing quality child care, all while building the child care system on the backs of the low-wage workforce. One of the biggest challenges currently faced by providers is the inability to attract and retain qualified staff to fill their classrooms, thus increasing enrollment and revenue. With an average hourly wage of $2.67 per hour and little if any employee benefits, do we blame them? Childcare providers cannot compete with businesses that are offering $15 an hour plus benefits down the road. From recent conversations with childcare providers, I can tell you that few providers, regardless of if they are publicly funded or not, would agree to providing childcare for less than what Ohio is currently offering. Fortunately, Ohio is expected to receive $1.2 billion from the American Rescue Plan to support quality childcare. This is an opportunity to strengthen our childcare system and build capacity for quality childcare across the state. However, in the Senate's proposal, they included restrictive language in their substitute bill, dictating that these funds cannot be utilized to support stipends or workforce supports or assist providers in improving their quality ratings. Additionally, the Senate's choice to restrict the spending of federal dollars calls into question if child care professionals will continue to receive quarterly hero pay and providers will receive program level grants as provided in the recent passage of Senate Bill 109, which appropriated funds from the December stimulus package. Millions of public, private, and taxpayer dollars have been invested into Step Up to Quality, which has been validated by 2 separate independent studies. This short-sighted decision will not increase child care capacity, nor will it save money now or later. In fact, it will likely shutter the doors for many providers who have invested so much in becoming quality rated, drive more early educators out of child care, open the doors to low quality and unsafe child care settings, and prevent children from receiving high quality care while inhibiting the parents' ability to return to work. While we have always known this to be true, the pandemic made it abundantly clear that quality child care is essential to children, families, businesses, and communities. Let's seize this opportunity to strengthen the child care instead of tearing it down so we can fully recover from the pandemic and make Ohio the best place to be a child.
Thank you so much, Julia. Up next, we have Susan Jacobs, the Director of the Ohio Property Law Center.
Thanks, Cassie. Good morning. As Cassie said, I'm Susan Jacobs, Director of the Ohio Property Law Center. I also serve on the Executive Committee of Advocates for Ohio's Future. Before the pandemic, many Ohioans did not have access, could not afford broadband services. The pandemic turned the internet into a critical lifeline. It's how we connect to our jobs, our doctors, education, services, and family and friends. But for the more than 1 million Ohioans who lack internet access, they were even more disadvantaged during the pandemic. And they will continue to be at a disadvantage until we ensure that all Ohioans can afford and access internet service. It's hard to participate in the modern economy, the healthcare system, the education system without access to high-speed internet. Researchers at the Ohio State University estimate that having full broadband coverage in Ohio would result in $1 to $2 billion in economic gains for the state over a 15-year period. Many of the households who lack access are in areas where the infrastructure for high-speed internet just doesn't exist. The $20 million Ohio Residential Broadband Expansion Grant Program, approved in House Bill 2 by the Senate last month, will begin to address the more than $2 billion that are needed to connect Ohioans. We were shocked and disappointed that the Senate cut the $190 million appropriation to further expand broadband infrastructure in House Bill 110 to help pay for the proposed tax cuts. The investment in expanding access to broadband seems to have broad bipartisan support. While the primary objective of the Ohio Residential Broadband Expansion Grant Program is to expand infrastructure in unserved communities, we know that issues of affordability need to be addressed if we want all Ohioans to be connected. The majority of households are without access because of cost. In 2018, 2/3 of Ohio households without broadband had household incomes below $35,000 annually, and nearly half had incomes below $20,000. The monthly bill for a home internet connection in most Ohio communities is now at least $60 per month, which is not affordable for many Ohioans who are already struggling to get by. The proposed income tax cut will do nothing to help these Ohioans afford or access internet services. There are models of how to extend affordability of utility services to low-income households, and we have suggested a number of improvements to the Ohio Residential Broadband Expansion Grant Program that would be first steps toward creating competition, ensuring Ohioans can afford to be connected. While we work for a comprehensive solution to affordability and infrastructure, we ask that the Senate reinstate the $190 million investment in broadband infrastructure and create or fund programs that address affordability of service and devices. Both the Ohio House and Governor DeWine made robust financial commitments in the proposed state budget to expand broadband infrastructure to unserved households. We call on the Senate to do the same. For those who do not have access to the internet, help cannot come soon enough. We are hopeful that the state's investment, coupled with additional federal dollars that can be used for broadband infrastructure expansion, we will have the resources needed to ensure that all Ohioans have internet access.
Thank you, Susan. Up next, we have Wendy Patton, Senior Project Director of the Policy Max.
Good morning. I'm Wendy Patton with Policy Matters Ohio, a nonpartisan, not-for-profit research organization that contributes to a more prosperous, equitable, inclusive, and sustainable Ohio. Come together and pool our tax dollars to build the foundation we need: clean water, safe communities, good schools, a bright future. Our elected officials fund government to create this foundation. But instead of funding the needed investments that we have discussed today, senators have prioritized $1.3 billion in tax cuts that primarily benefit the wealthiest Ohioans. They say they cannot afford to, for example, fix the broken school funding formula or ensure quality child care. They include a 5%, $874 million income tax cut, a sales tax cut for temporary agencies, and various tax breaks. Policy Matters Ohio commissioned a study of the impact of the income tax cuts by Ohio Income Group. We work with the Institute on Taxation and Economic Policy, which is a nonprofit with this sophisticated model of the state, local, and federal tax systems. We found that the bulk of taxpayers would get benefits so small they would be barely noticeable, starting with the very lowest income Ohioans. Now, under existing Ohio law and the Senate bill, taxpayers with income of less than $22,100 do not pay the Ohio income tax. Although these taxpayers on average pay a much larger share of their income in overall state and local taxes, in sales, property, cigarettes, and other taxes, but none of them would benefit from this income tax cut. In fact, 3/5 of taxpayers who are paying less than $64,000 a year in Ohio would get just 7% of the value of the total tax cut. Those in the middle fifth of the income spectrum making between $41,000 and $64,000 a year, on average, would get a tax cut of $22 a year. Nearly half of the reduction in the taxes of this tax cut would go to people in the top 5% of earners who are paid more than $221,000 a year. The top 1% of Ohioans who have income of at least $526,000 a year would receive an average income tax cut of $1,712 a year. And we see a whole quarter of the value of this income tax cut. Now, the tax reductions in the Senate bill come on top of really significant tax cuts the richest Ohioans have received over the past 16 years, while lower and middle income Ohioans, on average, saw a little change or even paid more in state and local taxes. The top 1% have received more than $40,000 a year in state income tax cuts since 2005. Senate President Matt Huffman claimed in a news conference last week that the income tax cut would incentivize Ohioans to go to work. However, even full-time jobs and many of the occupations hardest hit in the pandemic pay so little that the workers would receive no benefit whatsoever from this Senate plan. The money would not significantly benefit most Ohioans. The cut will bring resources needed for the investments we've described here today and others. Good schools, better child welfare, better child care, and all of these public services that benefit all Ohioans. Tax cuts like this are not needed. Ohio's lack of investment commitments after the 2008 recession helped create a slow, uneven recovery. The only tax cut this body should consider is one that would actually put money into the pockets of Ohio's lowest paid workers. Adding a refundable option to the state earned income tax credit would do just that, concentrating returns to working families that have been the hardest hit in the recession. We need tax and budget policy that actually benefits Ohio's working people, families, and students. The Senate budget bill doesn't do that. Trickle-down priorities leave out too many Ohio families and communities. Thank you.
Thank you, Wendy. Next, we have Mr. Nick Bates from One Ohio Now, as well as the Hunger Network in Ohio. At the conclusion of Nick's comments, we'll be taking questions from folks here in the room as well as those joining us virtually.
Good morning. My name is Nick Bates. I'm a deacon in the Evangelical Lutheran Church in America, and I serve as director of the Hunger Network in Ohio, a faith-based network that believes we can end hunger by addressing the root causes of poverty. I also serve as the budget and tax policy director at One Ohio Now, a statewide coalition of more than 100 organizations that believes great public services strengthen our communities and need the revenues to pay for them. As we just heard from Wendy, 16 years. 16 years, that is how long Ohio's legislative leaders have pushed an agenda of income tax cuts. In fact, since 2005, Ohio has reduced our income tax rates 9 separate times. Public policy, as we have heard today, requires us to be deliberative, rational, prudent stewards of the community resources. So after 16 years, what have all of those tax cuts achieved? Well, to be blunt, nothing. Ohio now is foregoing $7 billion a year in revenue because of these tax cuts. Job growth nationally has been 4 times greater, around 4 times greater than here in Ohio, despite this miracle elixir of income tax cuts. And in 2019, Ohio ranked 33rd for poverty, 34th for wages, and 39th for hunger. These sobering statistics show us that tax cuts simply have not worked to strengthen our economy for the vast majority of Ohioans. But it doesn't need to be this way. We have heard from numerous policy experts today illustrating that there are so many well thought out, deliberative, research-based ideas on how to build up a stronger community, to build up a stronger Ohio for all of us. We can build up a community where race, region, and zip code no longer determine the resources that are available for the education of our children. There is growing consensus on what it will take to finally fix school funding. Imagine if we spent 16 years properly funding our schools instead of 16 years cutting income taxes. We can build up a community where our foster care system mental health system, and others have the resources that they need to help kids find safety and security, to help families have comfort and support during difficult times. We can build up a community where no child will go to bed hungry at night, and every child will have access to safe, decent, and affordable housing. We can build up a community where all kids have access to physicians, counselors, and mental health professionals. Throughout this state, we have an abundance of compassion. We have an abundance of experts. We have an abundance of solutions. Throughout this state, we have an abundance of assets and resources. But what we lack right now, and for too long, is the political courage to solve Ohio's most pressing needs. Some think scarcity is good politics, but the reality is it's bad public policies for Ohio's communities and Ohio's children. The Senate's proposed 5% income tax cut, as we heard from Wendy just a moment ago, will not benefit the vast majority of Ohioans. In fact, they won't even notice it, except they will. We all will, with the lack of community services, supports, and investments that Ohio families and Ohio's communities need. With an $874 million, let me say that again, $874 million price tag throughout this budget. That's a lot of money. And there are plenty of other ways that we can use these dollars to help Ohioans and Ohio communities. Many of my colleagues in the faith community right now are asking not how to return to normal, but how do we return to a new normal as we emerge from this pandemic? A normal where we focus more on what matters and less on all the peripheral things that can distract us. A normal where we can allow old habits to pass away and allow new and healthier behaviors to emerge. I encourage our public servants of this General Assembly to build up a new normal in Ohio. We cannot make the same mistakes that we have made for so many years. We need a normal with less hunger and more fruits and vegetables. A normal with fewer mental health crisis situations and more preventative treatment and plans. A normal where all kids have access to great schools and internet and the technology they need to succeed. A new normal that supports youth involved in multiple systems. We need a new normal where we stop cutting taxes for the wealthiest Ohioans and instead invest in our children and those who are most in need. Thank you.
Thank you so much, Nick. And to round us out, when deciding the policy priorities and investments for the next state budget, leaders in the Ohio Senate have the opportunity and resources to set a visionary agenda that ensures all Ohio children, families, and communities recover from the challenges of the last 15 months successfully and even stronger than ever. Instead, the budget bill before us in the Senate is out of touch with the true needs of our neighbors and communities, and is far from building the future all Ohioans deserve. We're calling on Ohioans to contact their senators to reconsider the provisions of this budget, provisions that derail the Medicaid procurement process, that passes on critical funding for broadband infrastructure, jeopardizes quality childcare, and diverts critical funding for public programs and community services to pay for taxes. As you heard from our friends and all of our speakers today, there was a lot to discuss in this budget. We know we have some questions from folks in the room, as well as questions coming in from folks joining us online. So whenever you are ready, please come up. We'll also have our speakers available at the conclusion of our program to have those one-on-one conversations.
Yeah, what kind of reaction have you gotten from senators themselves on these?
Certainly. So the question was, what kind of reactions from senators have we had about proposed changes? I'm going to invite anyone from our speakers to come on up if they have anything to add. So we've had a number of conversations with senators, really considering, they're listening, they're considering the impacts that we are lining up and putting out of these provisions. We still know that there's another round of changes that will be released tomorrow. So we think some are listening. I would say a number of
Senators that we've heard are pretty set in their ways. We know that they will continue to have conversations with the House after the full vote in the Senate. So we still may see some changes. We have some hope, but we know that there are strong personalities in the Senate as well, and we will just continue to let them know about the impacts that these people have and educate them on really what's happening. Anything to add from our friends? All right.
Question for anybody, but specifically for Ms. Tracy, if you don't mind. You listed a lot of things that you want to see the budget do that it's not doing right now. Is there anything currently in the budget? So you said there are things that you'd like to see that are not in the budget. Is there anything that sticks out to you as something that takes the state in the wrong direction? Any provisions in the budget that hurt the goals that you laid out?
Yes, so I think we've laid them out in terms of, the Senate budget has a proposed school funding formula that was just introduced last Tuesday, as opposed to the House version, the Fair School Funding Plan, that was developed over a 2.5-year period with a broad-based coalition. Lots of work, lots of deliberation, lots of transparency went into that plan. And, now we're kind of rushing to try to figure out, okay, what just happened and what is this plan? So there's one piece. Another is the broadband. If we've learned nothing from this whole pandemic, it's that broadband is essential. I think about my parents who had problems, making their appointments online to get their vaccines. And I think about all the other people within our communities that either don't have access to broadband or they don't have a support network around them to help them, navigate it. And it's mind-boggling that we would think that it's not essential for people and just not important. And I think there was a Capital News article where one of our legislators had said something like, well, even if some people have broadband, they wouldn't know how to use it anyway, so it doesn't matter. I think that's just really troubling in general. And then also, when we think about Medicaid procurements, that was a transparent process. It was deliberate. I know my organization and many other organizations had opportunities for input and for feedback with the Department of Medicaid. They did an outstanding job with their process. And now to just, throw it, I think, in, kind of out the window as what's being proposed, I think that's also really disturbing for us because there's so many things, good things in the budget that are, dependent on that. Ohio Rise, 12-month continuous care. All these things that we need for Ohioans to be healthy. So I think that, perhaps people didn't understand what was dependent on all of these things, being in the budget. So we're just trying to make sure that they understand that and are aware of the decisions that they're making.
We have a number of questions from our folks viewing online. This one will be from our campus if you'd like to make your way up. So why is Ohio rebidding the managed care contracts?
Thanks, Kelsey. That's a really great question. And I think, we can all just look at the Health Policy Institute of Ohio's research. We're not achieving value as a state. So looking back to 2018, external quality review was mandated by the federal government and said, how are we performing? This happens every year with quality. They say, what are you doing in terms of performance? And I have some numbers from that quality review. These are comparing metrics that all insurers in the country use through healthcare effectiveness data information set, otherwise known as HEDIS, which is established by the National Committee on Quality Assurance, that's the QA. Only 52% of Ohio children got their health checks complete. Those are the routine developmental screenings. Fewer than 2 in 3 children get regular vaccinations. Fewer than half children had dental appointments. Only 60% of children enrolled had a blood test reported. So we are underperforming across the board when it comes to children's metrics. The children are only part of the equation. Only 2 of the 15 quality measures the state tracks, were above the 75th percentile nationally. So we're talking about a C average. We're only doing that 2 out of 15 times. 66% of women received postpartum care, so a third of women aren't even getting In regards to behavioral health, effective continuation of treatment was only achieved 1 in 3 times. 30-day follow-up emergency department visits for substance use disorder was only achieved 1 in 4 times. Hospitalizations for mental illness were only achieved 2 and 3 times. We're below the 50th percentile in managing diabetes. And then we also use more antipsychotics for children and adolescents higher than the national average. So across anything that anyone who looks at this stuff thinks about, we are consistently average or below average. And this is a $29 billion a year program, right? But 1 in 6 of the dollars that they appropriate flows to this contract. Let me just like put it differently, right? If you were having someone build your house and you had contractors and you were buying, you say, okay, this person does the framing and this person does the roofs, but we're going to make you buy the roof from people who have leaky roofs. You would be upset, right? Imagine if the state procured contract for highways where you would almost guarantee potholes. People would be incensed. It's the same thing here. So when we have all these conversations taking place in the General Assembly that say we need to do better and cost contain our program, ensure that there's high quality, effective Medicaid services being delivered, I would put it back to state and then let us have a competitive marketplace. Let's rely on these new entrants. Let's get more toward performance. And right now, especially when it comes to kids, when it comes to a long-term care delivery system, we could be doing a lot better, saving a lot more.
One more question for Lauren. Can you talk about the process for both the evaluation and then the appeal process for the managed care bidding process? We know that some of our elected officials have some questions regarding the process. They're claiming lack of transparency. Can you tell us a bit more about what the department had in the process?
Yeah, this is the most exciting contract conversation we've ever had. This process has been going on for years, and there was a multi-community effort to reach out to consumers, to reach out to providers, to reach out to others to determine other states who are doing better than us about what we should be doing. The state didn't have to do that. Procurement is a normal cycle. On average, procurement for this type of stuff happens every 6 years. And we went through this big, broad process. Some of this procurement, by the way, was mandated by the General Assembly. Don't forget that we have problems in the pharmacy benefit program. We're talking about the same stuff. Don't forget that we also have a challenge with necessary relinquishment in our state. This is the same sort of issue. State put out a website, there's 1,000+ page quality review that people can look at. You can see videos of the interviews being conducted by these plans. You can see how people score. So, you know, the idea that there was a lack of transparency after the dozens of hearings I've been to, the dozens of meetings that I saw, the fact that the state has a website with all this material is at least misleading, and most is good.
You, Lauren, Brent, if you'd like to go for the next question, I believe is for you. So as we've heard, leaders in the Senate call this increase in the income tax cut as a stimulus for working people or an incentive for folks to get back to work. Can you tell us a little bit more about why we maybe should be considering that as a large stimulus or incentive to get back to work, and what different steps the Senate could take in towards that goal?
And thanks for the question. The tax cuts that are under consideration overwhelmingly benefit very wealthiest people. But when you think about the wealthiest Ohioans who are going to receive on average $1,712 a year from this tax cut, when you compare that amount to their wealth, how much incentive does it give them? Further, for the wealthiest of Ohioans, they are the ones who need incentivized to get to work. This ways of helping people get back to work, helping working people get back to work, ensuring quality childcare. We know that one of the 3 leading reasons why women aren't going back to work is that there's no one to watch the kids. Kids aren't vaccinated yet. It's hard to get people to watch kids. It's hard to have a safe place for your children. The restrictive measures in the Senate budget work against helping women go back to work. The Senate could help women and mothers and fathers go back to work, but broadening child care, taking it up to self-sufficiency to 200% of poverty level for initial entrance into the program, for paying child care workers a living wage, so we have less turnover in the classroom, which in itself creates a better situation for poverty, for quality. There are other ways that the Senate could help move people into the workplace. Passing initiatives that prevent using the American Rescue Plan dollars for grants to essential workers like child care workers flies in the face of helping people get together what they need to re-enter the workforce, repairing the car, finding a job. There is a provision that would deliberately narrow the ability to use these funds for essential workers in the child care sector. This just flies in the face of what the American Rescue Plan is about and what working people need in order to get back on their feet. The General Assembly has provided legislation that expands rental assistance, that provides emergency aid to families. This is going to help stabilize people so that they can get traction on their life again. The tax cuts have nothing to do with it.
Thank you, Wendy. And last question on my list is Mr. Chambers, if you'd like to make your way up here. So the question points to comments from Senate President Husband regarding the removal of the $190 million in their version of the budget, claiming that he doesn't know that there's a plan for the dollars and that there is a need for the dollars. So Susan, please.
With 1 million Ohioans not having access to the internet, we know there's a problem. We know that there are households that aren't connected. There was broad bipartisan support for House Bill 2 to enact the broadband grant program. So we know there's a need, an immediate need, and the state dollars, $190 million, can start building that infrastructure now. We do need to have a comprehensive plan to address broadband infrastructure and affordability and literacy training, digital literacy training. And we hope that the Senate will commit to a transparent public planning process to spend the federal dollars that are coming to the state. Another provision of the Senate budget removes language to establish a joint legislative oversight committee on the COVID relief funds. The House will put that in the budget as a way to have a public, transparent committee to look at spending the federal relief dollars, and the Senate removed that language. So in addition to investing now in infrastructure, which we know is a need, investing now in affordability, which we know is a need, we also ask for a commitment on a transparent public process on how we're going to spend this federal relief dollars to support families going back into the workforce, to build the infrastructure that's needed, including broadband infrastructure.
Any other questions on support? All right, well, I want to thank you all for your time this morning and for your advocacy as always. Our speakers will be around to additional questions about specific provisions. Thank you so again for your time. We appreciate you, and thank you as always for your support to children and families.
Good to see you.
Same.